designed to help the person who may have an amputation or a person who can't tolerate inner pressure on his or her thighs. It is beneficial in situations where the patient is unable or unwilling to assist the caregiver with the placement of the sling, and is more comfortable for patients with extremely rigid legs. Remember, if the hammock sling will be beneath the resident for an extended period of time, you may want to try the mesh hammock-style sling for increased breathability and patient comfort. The hammock commode sling is also available with a commode opening to allow for increased patient and caregiver convenience. Toileting sling. The toileting sling is available for patients with adequate upper body strength, but who may not have adequate lower body strength. It aids a caregiver in removing a patient's pants with little effort. It also makes pericare much easier. This sling comes standard with a built-in safety strap to be placed around the patient's upper abdominal area. Note: the toileting sling is not intended for patients with little upper body strength or with lower extremity amputations. Recumbent bar kit, R-bars. The recumbent bar or R-bar kit was developed by SMT Health Systems to help transport hip replacement patients or persons whose bodies are less flexible. If you'll be using the R-bar attachment, please be sure to consult with the patient's healthcare provider for proper patient positioning and transport. Stretcher attachment. The stretcher attachment is used to transfer patients from bed to gurney. It is also convenient for lifting and weighing patients without having to flex their bodies into a sitting position. If you'll be using the stretcher attachment, please be sure to consult with the patient's healthcare provider for proper patient positioning and transport. The stretcher system is designed to be used on Volaro Series 4 lifts only. Safety and sizing statements. Inspecting sling condition. You are responsible for the safe operation of your slings and accessories. Before each use, always inspect the sling material and any loops, strapping, or other components. If any of these items have cuts, tears, fraying, or loose seams, the item should not be used, but instead replaced with a different sling before proceeding. Wash any soiled sling before using. In addition, prior to placing the sling on the resident, you should always check that the sling is the correct size and explain the lifting procedure to the resident. Selecting the correct size. To select the right size sling for your patient, make sure there are approximately 2 to 4 inches of material protruding past the patient's shoulders. Volaro lift slings come in many sizes to accommodate almost any person. All slings have color-coded handles for ease of size identification. Please see the sizing chart provided by SMT for color references. If one of the standard sling sizes will not work for your patient, SMT also offers customized slings. To order, contact our customer service department and we'll send or fax you a measuring guide. Or you can download a guide from our website at www.smthealthsystems.com. Sling use instructions. Instructions for placing and removing the divided leg sling with resident on a flat surface. After completing your safety and sizing checks, fold the sling in half and roll the person on one side. Lay the folded sling along the backbone of the resident, positioning it so the bottom of the sling is centered at the patient's tailbone. Overlap the top layer and tuck the sling close to the body so it will be accessible when the resident rolls back. Roll the resident to the other side, pulling the top portion of the sling out. Smooth out any wrinkles. Move the resident's legs apart slightly and bring the sling material under and between the legs. Thread either leg strap with color-coded loops through the opening at the bottom of the opposite leg strap. Straps will now be crisscrossed. You are now ready to transfer. To remove the sling, simply reverse the previous steps of placing the sling. Instructions for placing and removing the divided leg sling with resident in chair. After completing your safety and sizing checks, lean the person slightly forward to get clearance between the back of the person and the back of the chair. With the handles facing the caregiver, slide the U-shaped portion of the sling down to the person's tailbone. The center handle should be in the middle of the resident's back. Keeping the sling from twisting, work the leg of the sling along the crevice between the patient's legs and the side of the chair. Get as much material going toward the front of the chair as possible. If the back of the sling is not placed all the way down to the person's tailbone, the sling will not come under the leg easily. Raise the leg, pull the material through, and try to prevent any twists or wrinkles. Feed either leg strap with color-coded loops through the opening at the bottom of the opposite leg strap. Straps will now be crisscrossed. You are now ready to attach the sling to the lift and transfer the resident. To remove the sling, simply reverse the previous steps of placing the sling. Instructions for using the hammock sling. After completing your safety and sizing checks, fold the sling in half and roll the person on one side. Lay the folded sling along the backbone of the resident and overlap the top layer so it will be accessible when the resident rolls back. Position it so the bottom of the sling is centered at the patient's tailbone. Tuck the sling close to the body, making sure the top of the sling is aligned with the top of the person's shoulders. Roll the resident to the other side, pulling the top portion of the sling out. Smooth out any wrinkles. You are now ready to attach the sling to the lift and transfer the resident. To remove the sling, simply reverse the previous steps of placing the sling. Instructions for using the toileting sling. Remember, you'll want to use the toileting sling on patients with enough upper body strength to help in their care, to ensure they do not slip through the sling. The toileting sling is placed on the resident in a similar manner as the Volaro divided leg sling, except make sure the person's arms are on the outside of the sling and that the U portion of the sling will not go all the way to the person's tailbone. Also, position the material as close to the bend of the knee as possible. This will allow more clearance for disrobing. The leg straps will crisscross the same as the Volaro divided leg sling. Place the safety strap around the resident's upper abdominal area. Fasten the buckle and pull snug. You are now ready to transfer. To remove the sling, simply reverse the previous steps of placing the sling. Instructions for using the recumbent bar kit. After completing your safety and sizing checks, here are the steps to use the R-bar system. First, assess the patient's medical situation by consulting with the patient's nurse. To prep the lift, first remove the R-bars from the carrying bag. Observe the black nylon loops. If they are frayed, do not continue with the lift. Attach R-bars to J-hooks on the lift and double-check connections. Hang the R-bars directly under each moving hanger bar on the lift. The R-bars should mirror the movement of the existing hanger bars. Do not attach the R-bars perpendicular to the hanger bars. For safety purposes, observe the R-bar sling you will be using. Inspect the sling loops, strapping, or sling material and explain the procedure to the resident. If any of these items have cuts, tears, fraying, or loose seams, the sling should not be used. Now you can prep your patient by placing the abductor pillow in the groin area between the knees. Fold the sling and roll the person on the side. Tucking the sling close to the body, make sure the bottom of the sling will rest at knee level. Roll the resident back and pull the rest of the sling through, straightening any wrinkles. You are now ready to transfer. Instructions for using the stretcher attachment. After completing your safety and sizing checks, here are the steps to use the stretcher attachment system. First, assess the patient's medical situation by consulting with the patient's nurse. To prep the lift, first remove the stretcher kit items from the carrying bag. Observe the black nylon loops on the stretch frame. If they are frayed, do not continue with the lift. Attach the frame loops to the J-hooks on the lift and double-check connections. For safety purposes, observe the stretcher sling you will be using. Inspect the sling loops, strapping, or sling material. If any of these items have cuts, tears, fraying, or loose seams, the sling should not be used. Fold the sling. Roll the person on one side, tucking the sling close to the body of the resident. Position the sling so it lies above the resident's head and below the feet. Roll the resident back and pull the rest of the sling through, straightening any wrinkles. Install each stabilizer bar into the sewn-in pocket on the side of the stretcher sling. You are now ready to transfer. Patient lifting with Volaro products. General statement on preparation and safety. You are responsible for the safe operation of your lifting equipment. Prior to transferring a resident, it is recommended that the following steps be completed. Each caregiver must be familiar with the health condition of the resident. Review the person's chart to be sure the proper equipment is being used for that particular patient. With the proper equipment selected, inspect the mechanical condition of the items, always correcting any deficiencies prior to lifting. Be sure to examine the casters for excessive debris and check that the battery has sufficient charge to complete your transfer. In addition, always plan the transfer pathway, removing any obstacles which may obstruct your movement. When possible, we recommend that transfers be completed with the legs in the widest position. Finally, prior to lifting, greet and explain the procedure to the resident. Patient lifting with Volaro lifts. Bed to chair transfer. With the sling properly placed, you are ready to transfer your patient from the bed to the chair. Check that the legs of the lift are at the widest position possible. If the base must remain in a narrow position, widen the legs of the lift when it's out from under the bed. Move the lift into position by centering the hanger bar just over the person's navel. Lower the hanger bar parallel with the resident until the hanger is low enough to hook up the loops on the sling. Attach the shoulder straps to the J-hooks on the hanger bar, then attach the lower loops on the sling to the J-hooks. Double-check your connections. Note: be sure to use the same color loops on the shoulder and lower straps when hooking the sling to the J-hooks. Either the shoulder or leg straps can be connected first. When connecting the leg strap loops, it is important to use the same color-coded loop on each strap. By using the loops at the base of the leg strap, the person will be in a more reclined position. When using the middle loop, the resident will be in a more upright position. Most caregivers use the middle loop. Note: the end leg strap loops and the long narrow shoulder straps are for floor transfers. Tell your patient that you are about to lift. Then lift. As you lift, double-check the sling around the legs. If the material binds, stop lifting and smooth the material. Make sure to check the person's neck. You may need to support the head. Lift the person high enough to clear the bed. Then gently turn the person 90 degrees until the feet clear the bed. Note: use the remote control while turning the resident if it is more convenient. Move the resident to the chair desired. Position the patient over the chair by either moving the lift around the chair or moving the wheelchair under the lift. Lock the brakes on the wheelchair. Take the hand control and move behind the person. With both hands, grab the lateral handles attached to the back of the sling and begin lowering. Do not pull back on the handles until the person is about 1 inch above the seat of the chair. Then pull back. Use the best body mechanics possible. The person is now upright. Lower the hanger bar until there is enough slack in the sling straps to unhook them from the J-hook. You may now unhook the straps and push the lift away. To remove the sling, stand in front of the person and uncross the leg straps. Now lift one leg and start removing the material from the underside. Do the same with the other leg and pull out the sling material between the side of the chair frame and the resident. Lean the person forward and gently pull the sling material out from between the resident's back and the chair. Reminder: a hammock-style sling is not removed. Instead, it stays beneath the person in the chair. Chair-to-bed transfer. With the sling properly placed, set the brakes on the wheelchair. Open the lift legs, roll the lift forward, and lower the hanger bar until it's at the resident's shoulder level. Set the brakes on the lift and hook the sling loops to the J-hooks on the hanger bar. Double-check your connections. Tell your patient that you are about to lift, then begin lifting. Raise the person high enough to clear the bed. Move the resident to the desired location and center the person over the bed.